Hey everyone, and welcome back to the channel. Today we're tackling a topic that affects millions of people, yet we often don't talk about it enough: hair loss. Seeing more hair in your brush or on your pillow can be really stressful, but understanding the root cause is the first step to finding a solution. So, let's dive into the most common reasons why you might be experiencing hair thinning or loss. First up, and probably the most well-known, is genetics. This is often called androgenetic alopecia, or more commonly male pattern baldness and female pattern baldness. If your parents or grandparents experienced hair loss, there's a higher chance you might too. For men, it often starts with a receding hairline or a bald spot on the crown. For women, it's usually a more diffuse thinning all over the scalp, often noticed first as a widening part. This is caused by a genetic sensitivity to a byproduct of testosterone called DHT, which shrinks hair follicles over time. Next, let's talk about hormonal changes. This is a huge factor, especially for women. Events like pregnancy, childbirth, and menopause can all trigger temporary hair shedding, a condition known as telogen effluvium. The hormonal roller coaster messes with your hair's growth cycle, pushing more hairs into the shedding phase at once. The good news is that this type of hair loss is often temporary, and your hair usually returns to its normal thickness a few months after your hormones level out. Similarly, conditions like polycystic ovary syndrome, or PCOS, and thyroid problems can also cause hormonal imbalances that lead to hair loss. If you suspect a hormonal issue, it's really important to see a doctor. Stress is another major culprit, and I mean both physical and emotional stress. A major surgery, a serious illness, or a period of intense emotional turmoil can shock your system and push a large number of hairs into the shedding phase. You might not notice the hair loss until 2 or 3 months after the stressful event. This is also a form of telogen effluvium. The key here is managing stress. Finding healthy coping mechanisms like exercise, meditation, or even just talking to someone can make a huge difference, not just for your hair, but for your overall well-being. Now, let's look at what's on your plate. Nutritional deficiencies can absolutely impact your hair health. Your hair follicles are like tiny factories that need the right fuel to grow strong strands. If you're not getting enough key nutrients, your body will prioritize vital organs over hair growth. Iron deficiency, or anemia, is a very common cause of hair loss, particularly in women. Other crucial nutrients include zinc, biotin, protein, and vitamins D and B12. A balanced diet is your best defense. If you're considering supplements, it's always a good idea to chat with a healthcare professional first to make sure you're retaking what your body actually needs. Certain medical conditions and medications can also be a factor. Autoimmune diseases like alopecia areata, where the immune system mistakenly attacks hair follicles, can cause patchy hair loss. Scalp infections like ringworm can also lead to scaly patches and hair loss. Additionally, some medications used to treat cancer, arthritis, depression, heart problems, and high blood pressure can list hair loss as a side effect. Talk to your doctor. They might be able to suggest an alternative. Harsh chemical treatments like frequent bleaching, perming, or straightening can also weaken the hair shaft, making it brittle and prone to breakage, which can look like thinning. Giving your hair a break from tight styles and harsh treatments can do wonders. So, as you can see, hair loss is complex, with many potential causes. It's not just about getting older. It can be a sign from your body that something is out of balance. They can help you identify the specific cause and recommend the most effective treatment plan for you. I hope this was helpful and gave you a clearer picture of what might be going on. Take care, and we'll see you in the next one.